So as we're aware, and throughout our nation, we're now seeing a little bump in our COVID cases. In Abilene, we've also kind of recognized a little bump that has occurred. Presently in our hospital, our ICU is near capacity with 22 patients. Half of those are COVID patients right now. The hospital number of COVID is at 20. Half of those are on ventilators right now. The most common question is this occurring in patients who are vaccinated or not vaccinated? Well, I can tell you right now in our hospital, 3 out of 4 of the patients who are in our hospital with COVID have not been vaccinated. So we have 4 in our hospital that have been vaccinated. The other very common question is this because the vaccine is not working, or does it have something to do with the Delta variant? It most likely has to do with the Delta variant. And the Delta variant, as you're aware, has become the most dominant variant throughout our country. And so the assumption is that, yes, it's a Delta variant. As far as are we testing for the Delta variant? Well, in Abilene and in most places throughout Texas, you're unable to test for variants. So if we do a COVID test, it tests for all variants. It doesn't tell us which variant it is. It just tells us that it is COVID. If we want a patient tested for a Delta variant, then that patient is going to have their test sent to Austin to be tested at the state level. And those are random testings. Those are survey testing at this point. As far as what's different with the Delta variant compared to the previous variants we've had, it is a little more contagious, and it appears to be more significant in the younger population. What we have seen in a shift in our hospitalizations right now is that our population has moved from a median of probably 60 to 70 to down around 45 to 55 is the median age of admissions. And so we are seeing this variant be more active in the younger population. The vaccines, they are still very effective against this variant. You would say that 65% of the Delta variant is covered by the Pfizer and the Moderna vaccine. However, we know that with the vaccine, you can still get the Delta variant, and you're probably going to get a mild to moderate disease. So the vaccine is good. The other most common question is, are we going to have a booster? Is there going to be a booster for this? And at this point, the CDC has not made a recommendation for that. However, Pfizer and Moderna are working on boosters, and in those boosters, they are trying to devise and change a vaccine to cover this Delta variant. So that's just kind of a summary of where we're at. In our hospital, we're still masking all employees, all physicians, all healthcare providers. We're asking everybody who comes into our hospital to wear their masks. As far as what the CDC recommends, everybody's aware that they've made a statement that if you are fully vaccinated, then you should be back at pre-pandemic activities. So is that not true?
Oh, no, I'm just shaking my head.
So I'm sitting here watching Lynn. I just want to make sure that something didn't come out this morning and miss it. But yes, pre-pandemic, we are back at pre-pandemic. And that is the recommendations as of today from the CDC. So that has not changed. So for Abilene, Texas, we are still doing what we were doing yesterday, a week ago, a month ago. So that is just a very kind of summary, high level presentation, and I'm open for any questions.